what we can do, what we have done in the past. Thereby, at least in future, we can very effectively can make out the pandemic situation to be brought under control. Now I want to share my PPT. Please allow me.
Yes, sir. You can share, sir.
Yeah, okay, 1 minute. Yep. The present day, when we are looking this infectious state, and almost stagnated life of the individuals, community, and also industrial, it is not only giving a very big problem for the economical deterioration, mental confusion, and many more of the health disorders also. Today, as we see this COVID-19, which started last year, is a novel coronavirus distributed from China to worldwide in 2020. The impact is too big, too high to disturb even after big efforts of the government and social organizations. Medical, nursing, and paramedical volunteers, day and night working, they are trying to prevent the situation and regulate the situation. To some extent, they are happy. But a couple of days back, 90,000 cases were reported in one day in all over India. For 135 crore population, 90,000 positive and 1,000 deaths may not be a big thing, but still it is a grave situation. The exclusive prophylaxis, whatever has said in Ayurveda, is a remarkable. Probably it was not noticed by our officials. That's what my feeling is. Now, this as a COVID, when we are understanding, the first and foremost, it started as a nasal-respiratory viral infection, which is like a flu, and with a fever, of course, and severe acute respiratory infection. It has been SARI. This SARI is saying worldwide SARI, SORRY, extended to clot the blood in vessels, micro, and thereby extending to organs, and death is causing. From droplet to airborne infection, it has been spread. Recently, there is one more report. Even it is possible after 15 to 21 days, after negative, the people, those who are positive, is supposed to be witnessed with the coronavirus in the urine and fecal material also. That means this is not going to leave us in 2020, but it may extend up to 2021 also. Or in future, it may also become like a flu or malaria, dengue, or etc. The targeted population for this COVID is very specifically obese, diabetics, and asthmatics. Repeated attacks of the COVID also being reported. Even after 2.5 months, even after 6 months, once again the COVID re-attack was observed. The people were still confused how long it is going to be active, how long it is going to be passive in the human body. The SARI, the severe acute respiratory infection, looks like fever, cough, sore throat, nasal congestion, headache, and muscle pain or malaise, dehydration, sepsis, and otherwise sometimes shortness of the breathing is going to be there. This is all we are finding in the COVID. Especially the elderly and immunosuppressed people are showing atypical symptoms also. So as such, when we are understanding this, first and foremost is the precaution which has been said is to follow the mask, so that at least a prevention. If at all we do not spread to the others. The same way, if at all somebody is sneezing, we are not going to get affected with. In spite of taking the mask also, many people are getting different problems also. How this mask actually is going to work? Let us see. First and foremost, it is going to be of the oxygen and carbon dioxide levels, which are going to be in the normalcy and also in the later or with the mask when it is going to be there, how it is going to be is being observed. As we see with the oxygen, whenever is going to be usually 20.6% of the oxygen in the normal breathing person is going to be get reduced by the 17.4 after wearing a mask. The same way, the carbon dioxide levels of the 1513 ppm in the normal is going to become 8,487 ppm. That means we are going to have lots of the carbon dioxide inhalation, but the situation is going to demand only the much more oxygen. That means wearing masks in the community when we are outside is the better one. Still better is in isolation without mask to have more oxygenated oxygen in our lungs. Now, the clinical features of this COVID, incubation period is 1 to 27 days. The recovery time is approximately 3 weeks to 6 weeks. And frequently reported signs and symptoms, which are going to be of the four. Commonest is the fever, around 98% at the maximum. Cough is up to 82%. And myalgia, the fatigue is going to be around 52%. And shortness of the breath or the breathlessness is going to be around 30% of the population in total. Now, the diagnosis of the COVID, as we have had with different people, advisories, and first and foremost, we have to understand with the travel history, whether this person is in the endemic areas like China, Iran, Italy. Nowadays in India, whether you come from Mumbai, whether you come from Bangalore, the people are asking. CBC is the second one. We can very easily understand as a leukopenia is going to be observed around 30 to 45% of the patients. And secondly, lymphocytopenia is going to be very specific and understood up to 85% of the patients. Chest X-ray is the simplest thing which we can understand and we can prescribe. 60% of the sensitivity can be observed and we can understand with the X-ray itself, the person is going to have the problem or the coronavirus infection. The PCR is going to be another method, around 70% sensitivity up to can be understood. Just a CT scan is the one of the best, 95% we can understand and we can diagnose very perfectly with the chest CT scan. And otherwise, IgM, IgG combo test is going to be there for COVID. This is one of the most commonest thing which we are going to have. Presently, even the rapid test and regular test and everything is going on. Now, who are susceptible and how is the fatality? When we see the fatality out of the present times, cardiovascular diseases people, those who are diabetics or chronic respiratory problems or failures, and any hypertensive patient or otherwise cancerous patient are going to be most commonest people, those who have victimized and died because of the corona. Otherwise, the rest of the people, they have stability and they could recover very comfortably. The Ayurveda and COVID. When we are looking, Ayush, at present, we are having the standardization. Ayush has recommended few herbs after the long discussion with the eminents and stalwarts of the Ayurveda for the COVID prophylaxis. The Tulasi, Dalchini, Kali Mirch, and Shunt, and Munaka and Haldi. This is the first set of the things which have been given to consume either as a decoction, tea, or in the daily consumption, condiments, etc. Over the two past decades, even WHO was very much interested in Ayurveda, has supported many clinical trials even, and leading 14 countries to issue marketing for the authorization of the around 89 traditional medicinal products also. Now, the other immunity boosting helps also going to be very much good enough to control the COVID or to regulate the situation. Now, as we say, what are these immunity boosting helps? There is a very big list are going to be said, but each and everything when we are looking, how far it is going to be very effective in what sense? And secondly, is it easily available without any sort of the adulteration? And fresh drug availability is also to be understood. The moringa, which is going to contain 7 times vitamin C higher rate, is going to be best to build the immunity. The second is the neem, of course, antiviral from the beginning, antibacterial we say, and it is antifungal. Thereby, a virucidal neem is said to be used in a best way. Tulsi or the basil is a powerful germicidal and also antioxidant. Of course, the ashwagandha is one of the commonest prescription which we are going to see to boost up the immune responses, and thereby whatever the vulnerability is there towards the viral infections is going to be controlled. And Triphala churna every night at bedtime, 1 teaspoonful is going to be a best antioxidant, laxative, and also it is going to be rich in vitamin C and vitamin A also, and it is going to make the strengthening of the immunity in the body. Ultimately, as a prophylaxis precaution, we have to concentrate only on the immunity. The immunity boosting drugs are going to be continued here. The ginger, which is a condiment, turmeric, which is a condiment, and black cumin, condiment, garlic is, these 4 are very commonly used in the kitchen. The kitchen made condiments are most effective medicines. Ginger is one of the best antioxidant, and also it is going to kill the viruses. Secondly, it is a Vedana Stapaka also, and it is a pain reliever also. People, those who have the headache, and it relieves even the congestions of the throat. Throat congestion, throat pain, headache, all going to be relieved by the ginger by taking a decoction or using as a condiment in the vegetables which we are consuming. The turmeric is a common practice because of its curcumin, which is going to be inside, phytochemical, is going to strengthen the immune system, and also it kills the foreign bodies and foreign organisms. It's also bactericidal, virucidal also. The black cumin we less use, but still we use much cumin. Commonly, the cumin is the best antioxidant. People doesn't know it, but still they practice in the kitchens. The garlic is allicin. With the allicin in the garlic, it is going to make or become a germicidal, and it is a very, very good enough to make out. What Ayurveda is doing about this COVID? See, AIIA, All India Institute of Ayurveda from New Delhi, has got a very good treatment protocol established, and they have made relief for the many of the patients. This was given, permission was given very late, but if it is going to be given from the day 1, then it would have been very, 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 very convenient, and thereby, if at all, now all over the India, 500 Ayurvedic colleges, if they are permitted with this Panchakarma and Ayurvedic protocol to be treated for the COVID, we are 100% sure that we are going to achieve the goal within short time only. So as such, secondly, as this particular COVID is going to make the blood clots, Rakta Skandanam is necessary, is made by the COVID. That's why the blood thinners are required, or the Rakta Sravakaram is going to be. Rakta has to be, blood has to be thinned. The turmeric, ginger, and cayenne pepper are commonest out of. The turmeric is a blood thinner. People, those who are having any sort of the clotting problems, if they are going to use the turmeric as golden milk, Aish has prescribed on the same reason. If it is going to be a very good anticoagulant, even in Pakshaghata, turmeric usage is going to be very good enough. Ginger is the second thing, as we already come across. It is going to have a natural salicylate. That is the reason why it is going to be a painkiller. and secondly, it is going to become a blood thinner. Salicylates, always they are the blood thinning material. That's the reason why the aspirin is said to be one of the best thing to making the blood thinning. Here, the cayenne pepper is going to have once again the salicylates in a higher quantity, which is said to be a very powerful blood thinning agent. Now, some more are like garlic. The garlic, already that is the reason why we use garlic, and it is anti-thrombotic agent along with the antimicrobial agent. It is an antibiotic, antimicrobial, and also anti-thrombotic agent. Because of this anti-thrombotic property, the garlic is going to make the blood thinning. The cinnamon is one more thing. As the cinnamon, we commonly use in biryani, but using the cinnamon in different aspects, it is going to make very powerful blood thinning agent. And warfarin like material is going to be there in the cinnamon, and it is going to be good for the diabetes also. So as such, the cinnamon as a decoction, when we are going to have cinnamon, ginger, and tulsi, if these combinations we can make out of the in different. The next one is the vitamin E rich foods. Commonly, the almonds and safflowers are one of the best ones. Sunflower oils. Use or shift for the sunflower oils in COVID scenario is one of the best thing instead of using the other soybean oils and other things. It is going to protect it to a level, and wheat germ oil also is going to be good enough. Thereby, reduction of the blood clotting mechanism in the body in COVID situation and in post-COVID scenario, both way we have to look forward, and thereby we have to adopt some of the blood thinning agents which are going to be commonly followed as in Ayurveda, either in the kitchen or separately as a medicinal. Then, as the Ayush, what is going to recommend, what has been recommendations of the Ayush is the question. Now, Ayush said first and foremost, drink warm water throughout the day. Warm water is boiled and cooled always. The practice yogasana, pranayama, and meditation. Spices in cooking recommended are the turmeric, cumin, coriander, and garlic. And Chabanprash is as a rasayana has been prescribed, and herbal tea with that of the tulsi, dalchini, kali mirch, and shunt and munakka has been prescribed. Golden milk at bedtime with the haldi with the milk, when it is being used, it is going to be a prophylactic for the blood clotting. That is a anticoagulant factor is going to be regulated, and as a mouth freshener, lavang is one of the best thing, and it is a kantyam, and it is going to control the sore throat or the any infection or the irritation in the throat also. What Panchakarma is prescribed by the eyes are recommended by the Ayush in COVID-19 scenario. When a person is going to be active COVID positive and he is under isolation or otherwise hospitalization, we can make the Nasya nasal applications. 2 to 3 drops of the sesame oil or the ghee is prescribed by the Ayush, but whereas we can use the Panchendriya Vardhani Tailam and Shadbindu Taila very comfortably. This can be done by the patient himself as a Pratimarsha Nasya. The second is the oil pulling Gandusha Kabalagraha. The Gandusha Kabalagraha is also prescribed for the patient. He can comfortably done with the sesame oil or the coconut oil. But still better is Dashamula Tailam, Triphala Tailam, Khadiradi Tailam, as it is going to make the Kapha Harata also within thereby the oral salivation. Usually higher debris molecular or otherwise any bacterial end byproduct of the debris, heavy metal intoxications are also going to be secreted in the saliva and it is being discharged. That's why in the COVID scenario, whenever this virus is making a massive cellular destruction, the cellular debris is going to be excreted through the saliva only. That is the reason when we are going to make the salivary glands regulated and made out, Along with that, it is going to give lots of the spitting. Because of the spitting, the more and more drainage of this cellular debris, thereby the Kavala Gandusha is going to be one of the best one in the COVID scenario. Next is the steam inhalation Swedanam. The steam inhalation is prescribed with that of the Pudina leaves or Ajwain. Otherwise, it's better to go with a combination of the Tulsi, Lavanga, Karpura, or otherwise Jandu balm and Amrutanjan like balms also can be put in the hot water and inhalation can be taken, where the Sloto Sodhana and kapha pluggings within the nasal or nasorespiratory cavity are going to be opened. Because of the steam, the mucus is going to be melted and it is going to come out as a spitting out. The person, whoever is spitting, he has to be regulated. If the COVID positive, he should not contaminate the entire areas and he have to be within the area where the particular person is being isolated. Now the question of whether this particular type of incidentations were recorded in anywhere of the Ayurveda, do we have any past references to follow? Yes. The Janapadodhamsa Adhyaya in the Vimanasthana is an exclusively being said. How come this sort of the incidentation happen and what we have to do and how we have to make out what sort of the facilities we have and how we have to facilitate the patient. All these things has been said in the Vimanasthana. Very unfortunately, we are reading this Charaka Samhita much of the time as just a subject, but not understanding originally what Charaka Samhita wants to say. It is a book about showing, telling about the medical anthropology of the ancient times. It is going to speak the medical sociology of the ancient times. It is going to speak about the many types of the sciences, even like such of many things which we are going to make out. Hello? 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 Hello?
Yes, sir.
Why my PPT is not coming out?
Sir, it's visible, sir.
It's visible. Okay.
Yes, sir. Yes, sir. Visible, sir.
Okay then.
Sir, continue, sir.
Yeah. Because suddenly it stopped. I was confused a
Okay,
little.
sir. Okay, sir. Now visible, sir. Continue,
Okay.
sir.
I was speaking about the Janapadodhamsa. The Janapadodhamsa is one of the best chapter which has been explained in Ayurveda, the Charaka Samhita. The Charaka Samhita we speak as like a subject or Samhita, but in fact the Charaka Samhita is going to speak many of the things as such. What we are looking at, like medical anthropology, ancient medical anthropology, ancient medical sociology, all the things are going to be spoken out. As to be defined, the Janapadodhamsa, it is an environmental pollution which is going to be a contamination of the physical and biological components of the earth or atmosphere systems to such an extent normal environmental processes are adversely affected. This is going to be possible by 4 ways. That's what the Ayurveda has said. The first one is the Vayu, airborne or droplet infections. The second is the Udaka, the water contaminations. The third is the Desha, soil or environmental contaminations. The fourth one is the Kala, seasonal disparities. Out of this, Vayu, the air pollutions are going to be much more with that of the many of the factories and industrializations, and Udaka contamination is continued with the industrializations, and even we are not having a proper storage methodologies, thereby also we are making lots of the contamination. We are contaminating even with the different human bioexcretes also, and thereby this contamination is continued, and we have to check answer for this also. Ayurveda, what suggested for the Janapadodhamsa as a prophylaxis is this: when this Vayu, Udaka, Desha, Kala are going to be get contaminated or polluted, we have to undertake first and foremost is the precautionary measures. This is the best, of course. The prophylaxis which is going to be included is a preventive medicine. The preventive medicine in Ayurveda starts with the Panchakarma. Each and every Rutu Sandhi, we have to clean the doshas, and thereby elimination of the doshas in the Rutu Sandhi makes the ones to get stronger, and immunity is going to be raised in the person. And the protection from the pollution, we have to shelter the person from the away from the pollution also. And we have to prevent these measures. And the medication anticipating the adversity of the, if suppose the person is weak, we have to make him strong. When the person is febrile, we have to subside. That means symptomatically disease has to be subsided. If at all the person is individually is going to have any problem, we have to make him very conveniently to get increased his strength and everything. Especially we have to look forward. The first is the dosha and its placement, dosha in relevances, and third is the srotas and organ involvement. By looking these things, we have to plan a preventive method for that of the COVID-like situations of the Janapadodhvamsa is told already in Charaka Samhita. What Panchakarma is prescribed for the COVID-like situation, Janapadodhvamsa? People who are affected by the external contamination or pollution leading to death are to be best treated with the Panchakarma is the statementation. After proper Panchakarma, one has to undergo for the Samanya and Vyadhiharana Rasayana. That means it is being told in two-tier program. The first one is the cleansing, and cleansing the doshas from the body, and thereafter the person is going to make the individual to make the Vyadhiharana Rasayana Chikitsa. If at all the person is going to be get affected with any disease, the person has to be treated for the disease also. All the medications which are to be used, here there is one condition told in the COVID-like situation. The medicines are not to be procured now itself. The previously procured before to that of the situation getting affected, such medicines has to be used always, all the time. Now, there is a code of conduct which is being told for that of the during Janapadodhvamsa. The first is the Satyam, speaking the truth. Did you go for the China? No, sir, I did not go. But there is a passport entry that he is in the Italy or he is in China. Now, he has to speak the truth where he was and how he was and how he is going to make it out. The second is the shantam. Calm-mindedness, this can be attained through the meditation. Saucham, cleanliness. Satyam, Shantam, Saucham, Sadhurattam. The fourfold points itself is sufficient. The Saucham is a personal hygienic or personal cleanliness and surroundings to be get clean. If you are clean by yourself and surroundings are going to be clean, then how come you are going to get the any sort of COVID or any flu or any sort of the other infections? Never. The one more good word has been used is Atmagupti. Atmagupti is self-isolation. The self-isolation means it's a quarantine. The quarantine is being told in the Charaka Samhita long ago. If you consider this Charaka is of 9,500 and 10,000 years old, because it is before to that of the Ramayana. And if you are going to consider the English people, it is at least 2,500 to 3,500 years old. The self-isolation quarantine methodology was said in Charaka Samhita for the Janapadodhvamsa COVID-like situations. Hita Janapada. The next is live in a good, sterile places. And this is like sterile wards and brahmacharya, divide of the sexual conjugation. Nowadays, even the people, those who are at home, even the wife and husband are there, they are not going to be undergoing for any conjugation because even that can privilege to get the COVID-19 also. Nityam Sahasa, being with the friends and relatives in communication and secure position. And Bhuta Daya and Dana, compassion and charity. Somebody is get affected, don't criticize them, at least show some compassion so that he is going to be get cured faster and sooner. Now, There are some of the do and don'ts also told in the COVID-like situations. Do not consume food or the regimen which is of the Desha Viruddha. Viruddha Ahara is once again brought here. A Desha Viruddha, Kala Viruddha, Prakriti Viruddha Ahara is contraindicated in the COVID situation. If you are in particular area, otherwise the same word has to be understood. If you are in Andhra, if you are in Andhra, take only Andhra food. If you are in the Maharashtra, you take Maharashtra food. If you are in the somewhere, you take Bhojpuri food, and so on. That means the Rajasthani food or otherwise Gujarati food. That means whatever is common to be eaten or consumed in the particular locality has to be consumed, not like the pizza or something like that. Now, the second is the Vegadharana. Suppression of the urges always is going to increase or input the nervous excitation, thereby n number of the diseases are going to be get generated. Ati yoga sandharana. Anything, some people are doing very excess talking, excess eating, excess thing. Recently, I came to know in the news, one couple, out of the 6 months, they were at home under lockdown and they are eating and eating. They thought the lady abdomen was so big and they thought it is just because of the overeating. And one fine day she got some pain in the abdomen, went to hospital, and there the doctor said, your belly is not because of your overeating, you are a pregnant and you are now, how do we get delivered? And in a 1 hour she got delivered. That means this is the way Ati Yoga Sandharana is being done nowadays in the COVID situation. Sahasa Agatimata. There is one more attitude of the people. People are driving without mask on the open roads as thinking that he is doing an adventure. Such sort of things also to be avoided. Maybe he is just driving in the open road, but probably a couple of minutes before or there, somebody has sneezed and there is a virus in the same. So always the precaution has to be taken within. This is one of the most important thing which we have to make out. And follow right Arogya Anuvritti. Whatever is being said as in the 26th chapter, 28th chapter, 29th chapter, the Ahara Vidivishesha Ayatanani, how to eat, where to eat, what to eat, all these things which we have to follow. Now, in Janapadodhamsa, in the previous, are they prophylactic when before coming or after as it is being appeared? The most important is the Jara, which is going to be get treated in the Janapadodhamsa COVID-like situation. Most common symptom as it is to be regulated, immediate with effect as it is going to become or make the people little inconvenient. Pachana, Vamana, Apatarpana for the especially Janapadodhamsa COVID-like situation only has been said. The Panchakarma is a Pachana, Vamana and Apatarpana is the 3 things which we have to do very specifically for the fever in the COVID. This, how it is going to act. The first one is the Ushnodaka, which is going to make as a Pachana. The Ushnodaka, when it is going to make the not only Pachana, along with the Anulomana and Jadragri Vruddhi and also Sleshma Harata, almost to entire the COVID situation is being nullified. That's why the hot water is one of the most important and best thing of the Pachana Kriya. And if at all something is more inside and accumulated and it has to come out, when it is diluted with the heat of the Pachana Karma of the Ushnodaka, then it is going to come out as a spitting also. Otherwise, we have to get it eliminated also. Hot water is just to be avoided in few conditions, like whenever the person is having burning sensation, daha, giddiness, brahma or hypertensive, pralapa or atisara, or in the situation when there is a breathlessness and other things are going to be like. As this apatarpana, when we see, this apatarpana is of the 3 varieties which we are going to speak. Landhana, Pachana and Dosava Sechana, all the 3 apatarpana are to be done in the COVID. That means the Alpabala is to be treated with the Langhana, Madhyambala to be treated with the Langhana Pachana, and Bahudosha is going to be treated always with the Sotana. When the person with so much of the accumulation of the phlegm in the chest and lung congestion is there and chest is blocked with the mucus pluggings, that person has to be removed with that, not within it is going to be get suppressed. We have to make the complicated patients normalized, but not the patients normalized to be complicated. So when it is so much of the complication, people are not to be giving any their support for the making Langhana Pachana or the Sodhana Karma. At the time, we have to go for the Shamana Chikitsa alternatively, and we have to treat the patient till the time he is going to be safeguarded with. Now, out of the Langhana Artem, this is known to us very comfortably. Whenever we are thinking the Langhana, we are thinking only fasting. But fasting is one of the, that is the 10th one out of the top 9 we are missing. Out of the first and foremost is the Vamana. Vamana is the best Langhana. We have to cleanse the Amashaya because this particular entire scenario of the COVID is Amashaya Samuttana Vyadhi seated in the lungs. Thereby, it is to be treated with that of the Pranavaha Srotas, Annavaha Srotas together. And Virechana purgation is the second alternate. Very comfortably we can give, even though we have restrictions for the Vamana, Virechana can be prescribed either in the prophylactic period or in the active period of the COVID. The Virechana is going to be comfortably prescribed with Trifala Churna, or otherwise Swadishta Virechana Churna even. There is a regular laxation or purgation. If it is Abhyadi Modaka is one of the best one, Dugdhavati for the children, and we can choose different Virechanas as Aragvada Palamacha also. This Virechana is going to make even not only the Mala, it is going to make even the Kapha also being taken out by the Virechana if it is regularly being given. Of course, Nasya is already being accepted by the Ayush, and nasal insufflation is one of the best method. Even Bhapala Chikitsa also can be done. We can make the Sushma Churna of this Pipali and other things, and Marisha. A small quantity of this can be made out as a Bhapana, the powder form, which is going to make the local irritation. It makes secretion, nasal secretion, and this makes the flow, and the virus is going to be cleansed, and srotases are going to be cleared out. Of course, the people are the Pipasa, Marutha, Atapa, Pachana, Upavasa, Vyayama, all these things accordingly they have to be followed. Here, the Basti. How this Basti is going to be comfortable, or Basti is to be given here. Let me explain. Even the Basti which we are going to speak, the Basti can be very comfortable. Whenever we are unable to give any large quantity of the medication through oral route, the Basti is one of the best alternative route, especially for the water-soluble alkaloids. The water-soluble alkaloids are to be best given through the Basti Karma. Now, each and everything when we are looking at, first and foremost is the Langhana which we are speaking. What selection of the procedure and how we have to make it out, and what sort of the things and situation and how it is going to give. The Langhana is said to be best in pyrexia. And except in Shayaja, that is the person is very weak, Anilaja, Bhayaja, Krodha, Kama, Shoka, etc. When the person is not fit or when he is not able to be get starved, don't make him starved. The Pachana in case of the Taruna Jwara is indicated. The best thing is because here we can make the Niragni Svedals also, and Tiktarasa is going to be get used in the stage. This Tiktarasa usage is going to be comfortable. All the Tiktarasa Pradhana Dravyas are the Jwara Haras mostly in nature. The next is the Vamana Karma. The Kapha Pradhana, especially, COVID is a Kapha Pradhana Vyadhi. And especially it is going to give the Jwara. A Kapha Pradhana Jwara, under the influence of the COVID, it is going to give the Kantopolepa. Whenever this Kantopolepa or the Hrullasa is going to be there. The two conditions are going to be saying that the Hrullasa is the Hutklesha of the Kapha. At the time, the Kapha has to be eliminated through the Vamana only. When the people are repeatedly spitting and repeatedly getting the excess of the salivation, the person is very specifically indicated Vamana has to be done. Now there is a question comes. See, the PPE kits are supposed to be there, and even after using of the so many PPE kits also, many of the doctors were got exposed for the COVID virus. If so, why don't we are going to make with the PPE kit war and Vamana done for the patient, thereby the person is going to become cleared with the kapha and he is going to be normalized. Even the Vamana, under the rules and regulation of the government of India only, wearing a PPE kit, we can conduct the Vamana. There is no need to, nowhere the person has said not to conduct. Only the question is, the fitness of the patient is most important here. The patient is supposed to be indicative with that of the Hrullasa and Kanthopalepha. Then that particular patient is to be planned for the Vamana, and wearing a PPE kit, we can conduct the Vamana so that the patient is going to become very comfortably sooner the perfect. And the next is the Virechana. Whenever the long association is there, people are going to have mild to moderate fever for the 10 to 15 days. At that time, the best is the Virechana which we have to undertake. Or otherwise, the Virechana is one of the best prophylactic treatment in the COVID situation. Prescribe the patient every week as they are at home. Every weekend, once you are going to have mild to moderate laxation. Make your stomach entirely cleansed. That makes himself is going to be one of the best to boost his own immunity perfectly. Here, the Basti as a Niroha Basti has to be given. Niroha Basti is a very useful when the dosha are in the Pakva Avastha very specifically. Otherwise, when the patient is going to complain constipation, people in the Jwara, they are not going to consume the hot water much. Unless the more water is not consumed, there will be no proper softness derived or developed in the fecal matter. To create such a moisturing, you have to make this little more water to be consumed, or otherwise, comfortably you can give the Nirohobasti. For the Nirohobasti, very comfortably we can use all the, whatever the Ayush has said, or the Janapadadvans are told, are the medicines which are commonly of the Krimihara in nature. Dashamula and also the Krimihara Vidanga can be given. Sometimes, even whenever these Krimi-like situations are there, there is a one more practice of the Nirohovasti with the lime water. 10 grams of the lime is being diluted in 600 ml, 1 liter, and out of that, according to the quantity, is being taken. So this Krimi Harata is going to be observed with the lime water enema. Which is going to be one of the best thing for that of the COVID situation. Now, there are so many rules and regulations of the Ayurveda which are tying our hands. We are unable to make out ourselves. We are not unable to come into the front line to fight against. Why we are being divided and we are kept aside? Now, even though we are involved as helpers to other systems, but our own systems are not being indicative and we are not doing our own Ayurveda practice. As the news speaks, few institutions like Jamnagar, Jaipur, NIA and the AIIA, such big institutions were given. Now the government has to think, already there is an experimentation has been conducted in the big institutions to tackle the situation. Let the chance be given for all over the India Ayurvedic colleges to treat the COVID situation, to admit them and to treat according to Ayurveda systems. Thereby, the main health system, people have to be conveniently communicated and they have to be convinced well, and we have to seek a permission, and we have to get even the legal protection and insurance coverages for the patient and so on. Then it is going to make the situation very comfortable. Within 3 months, we are going to solve this problem if all the Ayurvedic people are going to start the Panchakarma against the COVID situation. Now, let me speak about some of the best prescriptions on the COVID situation. Whenever we are making a best prescription out of the COVID situations, we have to have the first principle is the Kafahara. The Kafaharata is with the Dashamula Katutrayadi Kwatha and Amrutottaram Kwatha as a Kashaya in the morning, 15 ml each, is one of the best thing. It is going to take out the entire phlegm. Dashamula Katutrayadi Kwatha is used in the Swasa and Amrutottaram Kwatha is used in the Jwara. The Jwarahara, Swasahara, these two things as a Pati Kashaya in the morning, at 6 o'clock when it is being given. If there is a luxation is required, then they add the Gandhara Hastadi Kwatha also. The total together 45 ml of this Dashamula Katutrayadi Kwatha, Amrutottaram Kwatha and Gandhara Hastadi Kwatha is going to make the person very comfortable. Swasaharam, Jwaraharam and Malabadharam or Vibandhaharam. Thereby, the person is going to have the best Kafahara effect in the body. The second is the Jwara. As already we have given the Amrutottaram, but for the specifically Jwara, Trishun tablet is a fortified Tribhuvra Kirtirasa or otherwise Tribhuvra Kirtirasa or Jaimangal Rasa, 125 mg BDTDS accordingly can be given. There are so many other Mrutyunjaya Rasa. Whenever the cells are at the massive destruction, we have to choose the Mrutyunjaya Rasa. As a Rasayana, we have to choose the Jaimangal Rasa. As a Jwarahara, Vatsanafa is there. Thereby, Tribhuvra Kirtirasa is said to be the one of the best antidote for the Jantavya Vishajanya Jwara. Jantavya Vishajanya Jwara to be treated with the Audvida Visha. Here the Jantavya is a Jantu is the virus, COVID virus. Jantavya Janya Jwara is the COVID generated fever. The COVID generated fever is to be treated with the Audvida, is the Vatsanapha, which is going to be treated one of the best thing to treat the Jwara. Next is going to be the Swasahara. If the person is going to have so much of the Swasa, if there is no Jwara, no need to give the Jwara medicine, no need to give the Swasa medicine. Only the Kafahara, Dashamula Katutrayadi, Amrutottaram Kwatha with that of the Gandhara Hastadi Kwatha is sufficient as a single dose in the morning. If the Swasa is persisting, Pushkar Mula Sava and Kanaka Sava can be given. Most important thing here is there are so many Swasahara tablets. If suppose so much of the patient, those who are having so much of the dyspnea, we have the much Swana combinations also. Swasa Kuthara Rasa, Swasa Kasa Chintamani. Swasa Kuthara Rasa commonly can be given. Swasa Kasa Chintamani to be given very specifically whenever there is a Rasayana effect and a chronic things are there with. And here the Rakta Skandana Hara. I was speaking about the blood clotting is one of the thing. It is this, I look this coronavirus is exactly opposite of the Ebola virus. Ebola virus makes the blood thinning. This coronavirus makes the blood clotting. This Rakta Skandana Hara is going to be achieved very comfortably with that of the Gairika. The Gairika 125 mg BD or TDs accordingly can be given and it is going to become or make the people blood thinning. The blood thinning best can be achieved with the Gairika or otherwise already we have said Haridra, Lasunna and so on. All these things can be used along with. Here the last one. As we are considering this coronavirus as a krimi, a krimi hara chikitsa also to be made with this. A krimi hara chikitsa when we are looking, the best krimi hara chikitsa is going to be with the Samira Pannagarasa or the Malla or Malla Sindhura. This Samira Pannagarasa and Malla Sindhura both are going to kill the, even it's one of the best anti-viral or antiretroviral. And along with, you can offer even the Vedanga and Nimba and other Tulasi, etc. of the different herbs which are going to be there used as a germicidal, virucidal, bactericidal, and in total, a krimi hara tagged in Ayurveda. Now, as to say conclusion for this, the COVID-like situations are not new for the Ayurveda. Literature provides abundant the past situation. 100 years back, there was a cholera. How it got controlled? Now the people were rabies was the same way. There are so many pandemics, endemics has come out. We have fight with that. We come out and we are here. The same medicines, vaccines are not there at the time. Still, we survived. How would we have survived? The same way it has to be. And the more chemicalization, it is going to give more ill in body, and people are losing immunity. First and foremost, we have to make the immunity boosting. All the panchakarmas are done even in the COVID situation and post-COVID situation, undoubtedly. As the Janapadodhvansa, we have a very big, best authenticative reference from the Ayurveda that in COVID situation, like Janapadodhvansa, we are bound to use all the panchakarmas to make the kapha harata, and we are not doing now. That is the reason this is prevailing more and more. Apart from this mainline treatment of the discussed out of this past half an hour, 1 hour, we may require more medications according to stage and symptoms. Say, for example, the person is, we have come across with, one is the obese, one is the diabetic, and these people, those who are going to be there with, these people, they are to be given those medications also along with. We have to regulate this weight, and we have to regulate the sugar levels of this, and we have to make out and treat the person very comfortably. Now, the diet and regimen has to be followed comfortably, like almonds and other things which we are giving as one of the dhatu poshtikam. And secondly, the rasayana chikitsa. Rasayana, when it is going to come, of course, Ayush has prescribed the Chavanaprasa because of the vitamin C content. But I prefer Agastya Haritaki as one of the best thing in this particular situation. I feel so. And mask and distancing is the one of the mantra in the Janapadodhvamsa and COVID, which has been stated in Charak Samhita to the particular Santata, Swachhata, etc. And especially the Atma Guptina. People, those who are getting infected, they are supposed to be isolated and quarantined. Then they are going to be get well treated comfortably when they are following the regular diets is being said. So as such here, I am very much thankful to the organizers, those who have given me the opportunity to speak over the Panchakarma and COVID-19 scenario as a title. And for that, I feel I have made a proper justification in this particular situation. And thank you very much for the organizers and the Yola sir, and also madam, and all the listeners, those who are with me all the time, encouraging me for this. Thank you very much.
Thank you so much, sir, for your valuable guidance. It was extremely informative session. On behalf of all the participants and our organizing team, I express our gratitude for your enlightening presentation on the precautionary measures and post-COVID management through Panchakarma. We especially
Madam, if at all there are any questions, then I would like to answer for the 5 minutes. And after that, I want to leave the session because I have some other work engaged with. Will it be possible? Or shall I join afterwards?
Sir, after all the